Thank you for inviting me to speak at this virtual event to mark World Hospice Day and the 10th anniversary of the World Health Assembly's resolution calling for palliative care to be a vital part of healthcare systems across the globe. My name is Sue Mumford and I'm Chair of Hospice Ethiopia UK, a UK registered charity. And we have been supporting Hospice Ethiopia financially and practically over the last decade. Hospice Ethiopia started more than 20 years ago by Sister Sigerida, and when I first visited in 2012 it was a small unit in the eastern suburbs of Addis Ababa. At that time there was no other palliative care being provided in the country, and that must have meant that many people across this vast country were dying with uncontrolled symptoms, both physical and psychological. Move on now to 2024 and what a lot has been achieved over the last decade. Hospice Ethiopia, ably led by Ephraim, continues to provide palliative care for those needing it in their own homes in Addis Ababa. Not only that, they also provide almost all the palliative care education in the country. And this is vital if this type of care is to be provided for people across the country who really need it. And I'm delighted to say that there are now palliative care services available in many of the regional cities, for example Jimma, Hawassa and Hara. There is also palliative care departments opening up in the major hospitals in Addis Ababa, for example the Tikirambessa and St Paul's hospitals. And in the community, the Addis Ababa Health Bureau now provides palliative care from many of the health centres. So what does the future hold? Well, there's no time to stand still. There is still much to be achieved if the World Health Assembly's resolution calling for palliative care to be a vital part of healthcare systems in Ethiopia. For many reasons, people in Ethiopia who receive a cancer diagnosis very rarely receive curative treatment, and for them, good quality palliative care is the only realistic option. It has been a pleasure for us to support Hospice Ethiopia over the last decade and to be a small part of their process in becoming a centre of excellence for palliative care. And we look forward to continuing to support them and to see what is achieved in the future as their work develops.